Hi, my name is Juliet Morrison and I am the head ICU nurse at Langford Vets. And in this little video series, we're just going to be talking about nursing patients with acute hemorrhagic diarrhea syndrome, formerly known as hemorrhagic gastroenteritis or HGE. So, this is a patient that's really struggling with their acute hemorrhagic diarrhea syndrome, and this was taken a number of years ago, probably when the disease was known as HGE. So as you can see from this patient, we've got an absolutely enormous amount of really hemorrhagic diarrhea, and these patients can present really peracutely, so in a really urgent number of hours in terms of their deterioration. So emergency treatment is really important for these patients as well, and the nursing sort of triage and assessment can be really pivotal to highlighting those cases that really need to see a vet very urgently. So thank you, Leo, for this picture. In this lecture, we're going to be discussing acute hemorrhagic diarrhea syndrome. So we're going to go through the terminology, the pathophysiology, presentation of patients with acute hemorrhagic diarrhea syndrome, and the triage and emergency treatment of these patients, because as we can see from that picture, they can present in a situation where they're extremely unwell. So that emergency treatment can be really pivotal to getting them to the next stage, where we then would want to be thinking about our nursing management more long term for these patients. So that's going to be more part 2, and we're going to look at fluid and electrolyte balance, pharmaceutical support, different drugs that we can use to try and make these patients feel better so we can support them, and nutritional considerations, and lastly skincare, because obviously these patients are producing a profuse amount of hemorrhagic diarrhea, and we really need to make sure that we're taking care of this patient holistically, and that includes skincare. So terminology, as I've said, we have had a change and an update in the sense that what was known as hemorrhagic gastroenteritis, we would now determine as acute hemorrhagic diarrhea syndrome. And as you can see from our little image, we're putting HGE in the bin. It's not a term that we use anymore. And that's specifically because the pathology of the disease process actually creates a lot of histological changes in the gut as opposed to the stomach. And the signs of vomiting are actually usually in relation to the inflammation, poor peristaltic quality of the inflamed gut. The actual histology and look and appearance of the stomach doesn't tend to be affected, which is why it's more appropriate to call it acute hemorrhagic diarrhea syndrome. The presentation of these patients. So these patients are typically small or toy breed dogs, as you can see in the image. However, as we saw in the first image, larger patients do present, so we can't exclude this diagnosis based on breed presentation. We have that peracute history of GI signs, and that word peracute meaning very quick onset, quicker than acute, which is typically 24 hours. This could be within hours that they might have deteriorated rapidly. So these patients will also be hyporexic, which means sort of inappetent, so they're not anorexic, but they're not eating sufficiently, so they are hyporexic. These patients will be tachycardic, lethargic, they'll have a high PCV, which is what we term as hemoconcentration, where the fluidy part of the blood has been compromised because we've lost a lot of fluid through diarrhea losses. So these patients will have a high packed cell volume when we run a PCV, a little hematocrit in-house. And these patients will often be hypothermic because they haven't been moving very much. They've got vasoconstriction because they're compensating for the loss of that fluid. The blood pressure will need to be raised, and to do that we will have vasoconstriction. So that might mean that we've got cold pores, cold ears, cooler periphery, and that might be why that we've got a cooler temperature for these patients on presentation. As I said, these patients will be hypovolemic and hemoconcentrated. So hypovolemic referring to the fact that within our intravascular space we have reduced fluid, and the actual volume content of the blood network is reduced. And this is a step further from being dehydrated. So when we talk about dehydration, that might be where we've got fluid that has left the left the periphery to say go into the gut lumen, and that's why we've got diarrhea. By osmosis, the fluid will then leave the vascular space to replenish that fluid, and then we will have a hypovolemic state. So if we don't correct that with IV fluid therapy, these patients will then sort of decompensate. Their cardiovascular status will be compromised, and it can lead to death ultimately. So hypovolemia is definitely something that's really critically important to consider for these patients at presentation and to take very seriously. Ways that we determine that is as part of our physical examination and presentation. So we can look at not only heart rate, but also peripheral pulse quality. How well are we perfusing the periphery? If we've got poor, weak, absent, or hyperdynamic pulses, that can give us a really big clue that this patient is needing fluid boluses and large quantities of fluid to try and treat their hypovolemia. Whereas when we talk about dehydration, that's something that we correct over a longer period of time. That's where we would normally correct it over sort of 24 hours as part of our fluid therapy plan. So a patient can be hypovolemic and hemoconcentrated, and it would be for those reasons. We would have mild to moderate changes on their haematology, so it's not going to be particularly severe. It might be that they have sort of mild inflammatory type changes on their haematology, and if they are sort of massively neutropenic, where they don't have a lot of neutrophils, that might give us a clue as to maybe this patient doesn't have acute hemorrhagic diarrhea syndrome. Depending on the age and history, we might more consider parvovirus, because those patients present with diarrhea and a neutropenia. And if our patient is pyrexic with a neutrophilia, we might consider more maybe a different disease process. So the fact that these patients have a sort of mild changes on haematology can give us a little bit of a clue as to maybe this is where our diagnostic track is heading. Hypoalbuminemia, so these patients will have a low albumin. Albumin being that large protein that is reduced in its production in a state of body inflammation. So we normally rely on that large protein to maintain that oncotic pressure, and that helps to keep fluid within the blood vessels. So if we have reduced albumin, we might have sort of more leaky vessels where we've got fluid potentially leaving the vascular system. And this is quite common in any state of systemic inflammation. It can give us a clue as to the fact that the whole body is affected by whatever disease process is occurring. And typically these patients will have mild increases in ALT, so liver parameters, and that tends to be due to acute hepatocellular injury as a result of that poor perfusion that we talked about earlier, with these patients having that acute profound diarrhea. That's going to have a really big impact on their ability to perfuse their ultimately their organs, and so that's why we see those changes in liver parameters. It's important to note that these patients do present with vomiting, as I said before, and about 50% of patients will present with vomiting with acute hemorrhagic diarrhea syndrome, and of those 50%, 80% of them will have hematemesis. That's where we've got that bloody vomit. So if we're ever receiving a phone triage and the owners are describing blood in the vomit, regardless of this being a consideration, that's always a case for making sure that that patient comes down to see us so that we can do a full examination, because that is markedly abnormal, as we know. So that's the end of our part one, our first little part of the lecture, where we've discussed what is acute hemorrhagic diarrhea syndrome in terms of its terminology and how do these patients present. In the next video I'm going to talk about the pathophysiology, so how does this disease process come to establish itself in our patients, and what changes happen in the body that create the symptoms that we see at presentation.